Greetings and warm wishes to everyone from Apollo Cradle and Children's Hospital, Rajajinagar. Today, I have an eminent national and international consultant, Professor Dr. Bharati Rajanan, fertility specialist, high risk obstetrician, and laparoscopy surgeon on board, who will enlighten us on the topic pain in pregnancy. This provides quality care for pregnant women, nursing mothers, partners, and relatives. We welcome you, ma'am, and over to you.
Thank you for a crispy, brief update of my profile. Good afternoon, everyone. Today I am here to talk about the pain in pregnancy. What? It is so contradicting, isn't it? Pregnancy is a natural condition. Why should there be pain then? Yes, I will elaborate on this topic. Pain is an unpleasant emotional experience, and also it is fairly subjective. It differs from person to person. There has been a vast study telling that 65% of the women perceive pain, in that 25% have severe pain and 8% are severely disabled. Why it is so? Yes, I'll go to the depth of it. Before that, let me just brief you regarding the pain. The skin, for example, the skin, it has got epidermis and dermis. The dermis has got sensory receptors, chemoreceptors, and pain receptors. So when we give a pinch, the pain receptors get triggered. These pain receptors, through the afferent nerves, sends the stimulus to the back spinal cord, that is, which is situated within the spinal cord. And this is carried by two nerves which are sympathetic, that is A delta and C fibers. The A delta carries the excruciating pain, and the C fibers, terminal fibers, are situated deep in the organ which carries the dull aching. So it is distributed between T10 to L1 space in the spinal cord. Why is this important? Yes, it is because the inner viscera, which has pain, send radiation to the skin. So we perceive pain. And there are medications which act on A fibers and C fibers differently. This pain can be of acute, means if it lasts for about 2 or 3 days and within 15 days it is relieved, it is called acute pain. If it goes for more than 1 month, 2 months, 3 months, it is called the chronic pain. So in pregnancy, can we divide it into acute and chronic? No, it cannot. Okay, it is, the pregnancy falls outside this classification. Now, coming to the specific causes why this pregnancy should have pain. It should be a happy motherhood, everyone, to accept it, isn't it? So, as a clinicians, how can we provide them a happy motherhood? Yes, first we need to know the cause. In the pregnancy, there is a hormone called HCG. This hormone is new to the mother. Means only when she is pregnant, it will be produced in the body. This hormone is distributed throughout the body and it's a new hormone. So how does the woman present with? She cannot tolerate this hormone. So she throws up. She has got nausea, vomiting, everything. Apart from this hormone has got different impact on different structures like breast, womb, abdominal wall, muscles, ligaments too. So, because of this pregnancy, that is the mechanical load, the gravitational load, and involving due to the biochemical changes, there will be stretching. This stretching causes a discomfort where the woman presents with pain. So it depends on how one perceives it. And they should know the technique, how to elevate it too. Now, coming in the breast tissue, there will be enlargement of the breast, so the skin stretches. Inside the fatty tissue, the breast tissue get enlarged, so they feel heavy, bumpy, and causes discomfort. Coming to the womb, it expands. When it expands, it stretches the abdominal wall. So abdominal muscle wall is at stress. And then too, even it stretches the diaphragm. So when it stretches the diaphragm, yes, the thorax cavity, that the chest cavity shortens and she feels gasp, difficulty to breathe, gasps. So a shortness of breath is seen. And apart from this, because of the enlarging womb, the ligaments get stretched. The womb, which is attached to the pelvic bone, that is the ring bone, which I will talk to you later. So they complain of strain, the stretching movement, where she feels discomfort because it feels uneasy. And all these pains, normal? Yes, there are three pains which are normal. That is the gas, which produces a colicky type of pain, which causes twists in the left lower part of the abdomen. And also, this burp is common, and she feels discomfort in the chest. And the stretching of the muscle, the long ligament strain, is a normal phenomena. Apart from this, one should remember that BH contraction, that is a Braxton Hicks contraction, tightening and loosening. Tightening and loosening. It is just like a heart pumping the blood, into the placenta, which may be so severe that the woman may perceive at times. This is normal. So the gastric pain, then the round ligament stretch, and the Braxton Hicks contraction, which are perceived from fifth month onwards, are all normal. Normal. Okay? Now, then how do we differentiate between the abnormal pain and the normal pain? See, if the pain, for example, the round ligament stretch pain, it is found in both the flanks and lower part of the abdomen. But one should be very careful. This pain can mimic or it can masquerade the ectopic pregnancy and the ovarian cyst, torsion, that is the twisting, or sometimes even present miscarriage. So it should not be overlooked. So it is when they consult the doctor, the gynecology obstetrician, they will give a proper advice. And if it is fine, she can relax. Otherwise, it causes anxiousness in the couple. Now, coming to the per se, the pain. So, as I told you, the normal one, which is the patient throws up in pregnancy, it is common and it can be alleviated by medications like metoclopramide, then pyridoxine or doxylamine. And it puts her to ease, but until 12 to 14 weeks, it may be continued because the hormones HCG drops from 10 to 12 weeks. And gastric, as I have told you. Apart from this, there are three things which are really important in a pregnant lady. That is the commonest complaint, the low back ache, isn't it? Most of the women tell, doctor, I have a back pain. I have got a pain in my tailbone. When I sit, it causes pain. Apart from this, they have got a pain in the pelvic region, that is the lower part, that is the ring bone, that is the hip bone, which is attached to the spinal column, that is the backbone. Because there is relaxation of the ligaments, these pelvic bone get flared up. When they get flared up, it may be difficult for the woman to balance when she walks. Okay? And when she walks, she has little bit of waddling gait. That is a duck walk we call, isn't it? This may get exacerbated because there may not be coordination between the right and the left part to put a position in such a way so that the woman is at ease when she walks. So she may find difficulty in walking. It may be so severe that it can cause pubic bone diastasis. This is a commonest condition. See, I have worked both in India and abroad, and I have found this to a lesser extent in India compared to UK and in Singapore. There they complain of this pubic bone diastasis too much, where they find so difficulty to walk, and when we touch the bone on the ligament that is below the lower part of the abdomen, in front of the bone, just above where they pass, where they go to pee, there is tenderness. In these cases, we take even a multidisciplinary input. That is, we refer them to the iris clinic and we take orthopedician opinion too. But it doesn't give a much comfort or soothing effect because hardly we can do anything. Here we advise them a brazier round the hip bone, and also we give sometimes few have to use crutches. So they need to work with that. And we advise them for these women not to walk much or not to sit much or to not to stand. So it should be balanced, both the sitting, the walking, and we advise them not to climb the stairs and also to take the rest where there is least pain. Apart from this, there are few medications which we advise them, which I will be recommending and briefing them later. So I have told you regarding the pelvic girdle pain. And coming now to the low back ache. This low back ache is very common. Why? This is because of the ligament stretch and paraspinal muscles, they go loose. When they go, they won't be taut. So it causes pain and cramps. And this, the woman may be scared that she has gone into set into the labor or miscarriage. This is due to the mechanical overload of the growing fetus and also due to the gravitational force. So at that time, we strengthen these muscles by physiotherapy, by relaxation, and also by hot and cold fermentation. Apart from this, we advise them patient the aromatherapy, the music therapy, which smoothen them and relax them. Really, it is troublesome, for few, and hence, we also, for severe patients, we give them TENS, that is trans electrical nerve stimulation, so that it regenerates the nerves and keep it taut and helps the woman. Where it comes in a gadget and they put it around the waist. And apart from this, we also advise them, the family members, the bystanders, the relatives, everyone, to give a support in a sense that this is very common. See, though it is so easy to tell, it is difficult to experience. Similarly, the partner who is going through this visual evidence, that is seeing their wives suffering, sometimes puking up, sometimes constipation, which is a commonest thing, which can mimic the pain abdomen. And even they feel really anxious, fear, brain fog, or irritable, depression. And this component in the male is called covert syndrome. Do you know that? Many of the patients come to me. Before conception, they would be smart. The partners. Later, they leave their beer and they hardly smile. This is, they cannot see their wife running to the torture. And this is a covert syndrome, which is a matter of debate. Telling you the commonest elements. See, in this pregnancy, but one should remember that this pain and the clinician should not forget to rule out ectopic pregnancy or fibroids degeneration. Many women conceive with fibroids. So if they undergo red degeneration, it is important for the clinician to pick it up. Apart from this, the constipation can mimic the pain and preterm labor should not be forgotten, should be kept. And after 28 weeks, it is very important to remember that there can be even abruptio, placenta, or preterm labor. So when you visit your doc, you can discuss with her all this and you can keep yourself calm when she reassures you that nothing is going to go wrong. But sometimes it is very difficult to predict. Now, coming to certain conditions where pregnancy masquerades this, that is, especially in three ailments. One is the headache. The individual may have the migraine earlier, but later she may think that it's a migraine which is causing her disturbed sleep and headache. But one should remember it could be a subarachnoid hemorrhage or increase in the eye intra acute angle glaucoma, or it could be cerebral vein thrombosis, or it could be a rupture of cerebral aneurysms. So it is better to consult and take a MRI scan at that time if it is not relieved by any medications. And coming to the low back ache, sometimes quad equine syndrome, local abscess, shingles can all mimic the low back ache. So we should not take it at the ease. And even coming to the abdominal pain, we may think big or small things. But we should not forget there are even other organs in the abdomen, like liver, gallbladder, causing cholecystitis, or the kidney, the renal stones, or pyelonephritis, secondary to urinary tract infection, or it could be appendicitis, or it could be Meckel's diverticulum, and sometimes medical conditions like sickle cell crisis. Okay, all this and many of the other conditions like urinary tract infection, cystitis, everything, or rupture of the uterus too can mimic this condition. Now, let me briefly tell you how do we go about after the investigations if everything is found normal. The doctor, see, when I advise you the medicines, they will be reluctant. You may hear many of the attenders or the relatives telling, don't take much tablets, don't take much medications. So what are the non-pharmacological conditions? The way we approach to, as I told you, breathing techniques, relaxation techniques, hydrotherapy, physiotherapy, music therapy, aromatherapy, everything helps because it gives support and it brings down the ailment for around about 40%. And also, we have introduced Lama's technique, that is breathing and relaxation technique. This we advise women only after 28 weeks of pregnancy because before that, if they do or if something untowards happen, they may land up in preterm labor. Okay, so we recommend the pregnant woman to attend the LAMAS classes where they will be put on to the supportive group. Means they will interact with the other pregnant women, exchange the views, the ideas, and they calm themselves then more than the doctor says. So the counseling is very important for everyone. And it is important even for an obstetrician to give time and discuss this with their patient to put them into ease and to gain the rapport, that is the trust, which is slimming nowadays. I regret to say that, but I feel that the trust is the most important bond between the doctor and the patient. Yes, now I have briefed you everything regarding the pain. Hope it is clear. Now I will moving on to the pharmacological conditions. That is, see, when we do all that, but if still our clients have pain, we recommend them acetaminophen. That is paracetamol. After COVID, all of you know very well that Dolo, the popular name, isn't it? So we recommend them paracetamol tablets around about 500 to 650. Some people tell me over phone, doctor, I've taken only half tablet. Hope it is doesn't cause any side effect profile to my baby. No, I do not mean. it should be taken in the proper dose, 500 to 650 milligram, and it can be taken maximum to 4 gram. See, for example, when we keep a rice, we keep water. If it is small quantity, the rice won't be found. Similarly, if you take off tablet, it doesn't cure. So you feel that you are not relieved. Okay, so that is very much important, the proper dosage. But when I was working abroad, they, if it is more painful, they give morphine and even dimorphine. Okay, but in our country, we in India, we give them with paracetamol and ibuprofen, that is the brufen, which is good, and it doesn't have much side effect on the baby and on the mother. It may cause little gastritis, and better they can cope up with antacids. But if the other NSAIDs means the non-inflammatory, okay, anti-inflammatory drugs which we give, it can, if it is taken in large quantity, it causes pulmonary hypertension in the newborn baby. Pulmonary hypertension, okay, so that the baby will have difficulty in breathing, and also it can cause premature closure of patent ductus arteriosus. Patent ductus arteriosus, okay. So it is important to remember and to reduce it as much as possible, and to take the complementary methods to alleviate their symptoms. Now, I have been talking briefly about all this pain in the antenatal period, that is, from the pregnant until she goes into labor. Okay, all these methods are for the first trimester, second trimester, and the third trimester, that is during the antenatal period. Now I am moving to the intrapartum period, that is the labor, which we focus more on. Means, in a sense, the intrapartum period, that is the woman sets into labor, usually after the period of viability, that is 37 completed weeks. But some women can go to pregnancy to deliver early. They may have different conditions like if it is abruptio placenta, that is ELP syndrome. See, this is very important condition where the woman present with pain abdomen and even gas heartburn and nausea, headache. So we should not take these symptoms very easy. The obstetrician should have an eye on them. Okay, so other associated with other condition, there can be ELP syndrome, there can be headache, there can be pain abdomen, and we need to treat it promptly. When the woman, as the pregnancy advances, see, because of the hormones effect, relaxin and many other hormones, the collagen, the stiff ligaments are broken down. That is the mouth of the womb. The mouth of the womb, that is the cervix we call, which is like the ear, pinna, which is very hard. And as the pregnancy progresses by the term, it becomes like the tip of the nose. And during at the onset of labor, it should be like the lips so soft, so that it blooms. That is, the cervix open for 10 centimeter and allows the baby it to creep down. So this is the natural phenomena which occurs. Okay, and women should know that all this is not modified or tailored by medications. It is by the nature of the body which takes care of her. See, when the woman steps into the labor, there are three phases. That is the latent phase, the active phase. Okay, the latent and the active. And then the second stage, that is the process of delivery. And the postpartum phase, that is soon after delivery. See, in pregnancy, in the active phase, usually it may last for 1 to 3 days because the woman may have spotting, but the womb would have not become soft, or the womb may not start acting. So, when do we tell that the patient is in pain? When there are three uterine contractions. That is the contraction and relaxation of the womb, which occurs 3 in 10 minutes, and each lasting for 15 to 20 seconds and in an ascending order. And if associated with bleeding or leaking or associated with any discharge, okay, then we tell them that she is in labor. If it is more than 3 centimeters, we tell them that they are set into the active phase. Okay, and coming on now, when the patient is in the latent phase, which we start go for 2 to 3 hours, or sorry, 2 to 3 days, they need a support. Okay, we need to encourage them. Take good food, drink plenty of water, walk, okay, or rock, or semi-reclining position to be relaxed, and they need support. We need to encourage them. We need to tell them that even our mother, the grandmother have all gone through this process, and we need to tolerate. And God is really great, not like other pains, which is continuous. He has given time in between the pain to relax. So at that time, she has to relax, and when there is pain, she has to bear. Okay, and see, in my personal view, I can tell that when I was working abroad, hardly the woman shouts or open their mouth. When they have got pain, just they do the sign language. They tolerate and they move upon. But only in India I have seen them shouting. I don't know. Is it because of more emotion or because of more bondage, or it is due to lack of TLC, that is tender loving care? I really doubt it. And I tell my clients, please don't shout because you get exhausted. The throat gets irritated. It doesn't help you at all, even crying and shouting. So at that time, how do we elevate them as a doctors? How do we see the smile on them? Okay. So during the first phase, during the latent phase, we give them little sedatives. Okay. That is a tramadol, that is the opioid where it acts. And also, or we can give them the pethidine. Okay. It puts them to sleep, and also it alleviates their anxiousness. So it helps in dilatation, and we give them smooth muscle relaxants too. And when they set in to the active phase at 3 centimeters, they have got wide options. We can continue tramadol once in 4 hours, pethidine once in 4 to 6 hours. Okay, but if they are still cannot bear and they are in blues, okay, we can give them Entanox. That is 50% oxygen, 50% nitrous oxide. Huh? When I tell nitrous oxide, don't you feel there is a laughing gas? Yes. They inhale it through the nozzle as and when they do, when they want, so that it puts their pain to the 50% to the lower level. Okay, and they can relax in between the contractions, and it is self monitored, and it doesn't have any impact either on the mother or on the baby. It can cause little drowsiness in the mother, but still she can be ambulant because gravitation helps in descent of the baby. So ambulation is very important. If the mother cannot cope up with this, okay, and we can offer them the painless analgesia, that is sleeping analgesia, walking analgesia, that is epidural, which is a new innovation. And most of the patient opts in USA and UK. And even I too recommend because I cannot see my patients in blue. Okay, this epidural block, it is called. This epidural block is a procedure where we give injection to the spinal cord, that is the backbone. The anesthetist do that, and it causes numb below the belly, the sensory touch will be low so that they cannot perceive pain, but the motor ability is maintained. And this we recommend them. For this, we need to counsel. This counseling is done as a birth plan template at 36 weeks. So at 36 weeks, we put them to the anesthesiologist where they counsel them. And if they opt, they can. Okay, in this epidural block, we give, that is painless labor, it is called. Okay, when the woman cannot bear, we make them to sit or lie down, and the anesthetist introduces a small needle into the back, and later they pass the plastic cannula and remove the needle and fix it up. And they give the anesthetic drug called lidocaine or bupivacaine. Okay, in the dosage they have calculated. This can be given as a bolus dose or it can be given as an infusion so that the pain is maintained throughout. The one advantage of this epidural analgesia is the patient will be happy and they receive the baby consciously followed, and it is good that they hold the baby and they don't have pain, and it is encouraging even for the couple to take it over. But one should remember that all the patient cannot fit into this. Means we cannot give epidural analgesia to everyone. Okay, few patients who have got platelet less than 80 lakhs, or who have got bleeding disorders, or whose INR is more than 4, that is blood thinning agents. When I come to these blood thinning agents, I like to mention it here one point. In the antenatal period, some women complains of severe pain in the legs, I told, cramps, right? This cramping in the leg could also be due to the varicose veins, where they can elevate the limbs or wear stockings. One more, the severe condition which disables them is the DVT, deep vein thrombosis. There can be clotting in the legs, which this clot can migrate into the lungs or any part and really endangers their life. So we give them blood thinning agents. So if they are on these blood thinning agents, we should be very careful in inserting the catheter and removal of the catheter, because if it bleeds inside the spinal cord, it is not good. It causes little complications for the woman. So we need to adjust the time for it. So in this patient, we use it cautiously. If there is local deformity of the spine, or if there is any infection, or if there is any brain condition causing increased intracranial pressure or cardiac condition, we withhold them from epidural analgesia. So we need a proper counseling and vigilant monitoring, because when we offer them epidural, it should be offered in a birthing place where it is fully equipped with the doctors, with the active midwives, anesthesiologists throughout. Because after we give the anesthesia, they can be dropped in the BP. At that time, it could be deleterious for the mother and for the baby. So IV line should be on, and if it drops, we give an antidote, epinephrine, so nothing to worry about it. Then moving on, there can be alterations in the heart or in the baby's heart rate, or if there is any fetal distress during the progress of labor, we can wheel them to OT for and convert it to cesarean section with spinal and epidural box. So it is an easy advantage so that we can wheel them quicker. But we have seen the most advantage with the epidural is the patient's anxiousness comes down. They are relaxed. When they are relaxed, the cervix opens up faster. When the cervix opens up faster, there is quick and easy delivery. The one more advantage of epidural analgesia is It causes vasodilatation in the placenta. So improves the blood circulation in the baby, improves the fetal heart rate, which is advantageous, and we can allow them for normal labor. Okay, so this is really a miracle. Having a baby without pain. So why can't one opt it? But regarding, one should remember there are few complications. That is, the epidural can be ineffective, or it could be patchy, yet they can perceive the pain. But sometimes, if it is extended, it can cause problem into the heart and on the lungs, called extended. But a doctor who is there around will be vigilant, and the drop in BP will be monitored. So but one should remember that 1 in 1 lakh may have the complication, but it can be corrected with vigilant monitoring. And moving on, see this, if one doesn't opt the epidural, they can bear the pain. When I was working abroad, okay, there was a pool birth. In UK, yes, pool birth is very common. That is the mother in the pool, okay, in the warm water, lukewarm water, I mean, okay. That is, it is a chilled countries, so they feel to walk about, okay, they feel very comfortable, and it is really good when they give the pack, so they take opt the pool bath. But I personally do not like it or recommend it. Why? Because I have seen the women who pee there, poo there. As soon as the baby, and it's so difficult for the doctors and nurses to do PV examination to assess and to bring them out. And when the baby is born, that the baby will suck in, and we need to do immediate resuscitation of the baby. But yet, when they opt, we cannot deny, isn't it? Yes. Now, what are the other alternative managements if they don't opt and if the woman goes in for labor? See, we give a episiotomy, that is a deliberate incision on the perineum. That is, we cut so that it allows the baby to come out easily, so that it cuts short the second stage. When the second stage, at that time, we give perineal infiltration. Okay. Apart from that, we give pudendal blocks and we give perineal blocks. Understood? Pudendal blocks and the perineal blocks. These blocks prevent them perceiving the pain during delivery or during suturing. So, hope I have made my point clear for all of you regarding the painless labor and the analgesia, the medications which we use during the antepartum period and the intrapartum period. Now, me going to the postpartum period. What is this postpartum period? Soon after delivery, it is not like washing of the hands. Okay, still the placenta should come out. The patient will have after pain. That is, the womb will contract and the placenta expels out. Okay, and at that time, if the pain is more, we need to explore the uterus or the vagina to see that there is no lacerations, there is no collection, there is no hematoma, there is no bleeding. At that time, anesthesia is important. We may give sedation for the patient and explore, or do under general anesthesia. Okay, and after delivery, we need to observe her. She may have pain in the bottom, where we give her paracetamol suppositories or injections to alleviate the pain. But one should not negate it, because the pain could be due to the collection within the uterine cavity or infections. So we need to be careful regarding that. And apart from this, we have to give them antibiotics by checking after the complete blood count if there is infection, to prevent the sepsis. Postpartum period is very much important, because all the organs which has been will be reset to the original. So it takes around about 4 hours, and 4 hours of first 4 hours is critical. Soon after epidural, some may face problem to urinate, to pass urine. So at that time, we may have to pass the catheter to drain the bladder. And soon after that, we have to encourage the woman to drink more water, to ambulate, and if there is any history of clotting, she needs to put varicose veins, stockings, for antithrombotic, sorry, TDD, TED stockings. And also we give her low molecular weight heparin to thin the blood for about 6 weeks or 1 week, depending upon the condition, on the medical comorbidity she's having. So now exercises in the postpartum period is very much important. That is the Kegels exercises. Because of pain, the patient may be reluctant. We have to put them to the postnatal classes where they teach them about all the exercises to put it back to normal. So I've, now I've given you a concise review of the pain management in pregnancy. Hope this talk puts your doubts into ease and clarifies also your doubts. Now, there are many myths regarding the pregnancy, the medications what we use. The most robust question is, doctor, after spinal or after me taking the injection, I will be having back pain. How to alleviate it? Or after C-section or after epidural, I've developed back pain. See, many studies and researchers, randomized trials have proved that the spinal anesthesia or epidural does not cause the back pain. If it was so, why does the old woman who had normal delivery will have back pain? Why does the men develop back pain? Please answer me. It is because you people are not doing proper supporting for the backbone, that is the exercises. And also, I'll tell you, in the postpartum period, okay, the woman, when she feeds her baby, she has to feed in a erect position with a back support, with a pillow supporting the baby so that to maintain a spine straight. If she bends, yes, the muscles go weak. Understood? Because already we know that the muscles are lax. So we should not put them into strain. So it is important for them to sit straight, feed the baby, use the feeding pillows. Okay? And coming to the next question. Doctor, if we use painless labor, will it help VBAC? That is vaginal delivery after cesarean section. No, the painless labor doesn't help in VBAC, but it depends on the cause of C-section. If it was for the obstetric condition, yes, the obstetrician can leave the woman to go for normal labor. That is, she can allow, if it is a normal baby, normal lie, vertex presentation, that is the baby head down and the cervix womb mouth soft, and she sets into natural pain. And if she progresses without any medical comorbidities, yes, she can, and epidural can help to alleviate her pain and for the easier dilatation. Yes, at that time she can. And please take a message from me. Caesarean means not a neck caesarean. 50 to 70% of the people, of the women, can have normal delivery if there is a normal spacing. That is the time frame between the first pregnancy to the second pregnancy is at least 2 years. Okay. Now, the other big myth is, does overdosage of the medicines cause any harm for the baby? Yes, already I have highlighted this. The medications are used cautiously and they cause least impact on the fetus, except for the other NSAIDs which I told you, which causes impact on the neonates. That is the pulmonary hypertension or premature closures of PDA. But still, I do recommend everyone to use the complementary method, that the non-pharmacological method, and only if excruciating pain to go for the pharmacology. Before that, consult the obstetrician to exclude the disease behind the pain and then take the tablet. Don't use OTC medicine, that is over the counter medicines unnecessarily, and be calm. the yoga, the music therapy, the support from the family members is of great help, including the doctor, including the staff in the hospital where they deliver. So I have seen in UK, many of the patients go for home birth. They convert the room itself into a delivery room prior to delivery so that they will have good support. Yes, it is good. But if there is any high risk cases, we do not recommend them. And one should remember that this home birth facility should be very close to the hospital so that they can wean faster. Okay, now with this, I conclude my talk on pain in pregnancy. Hope I was clear and hope all of you have a benefit and not suffer in pregnancy. Okay, enjoy the motherhood. Thank you.